Good morning. This is Dr. Lugo with Pediatric Dentistry, chatting with my YouTube followers, 6 or 8 people that see these videos every once in a while. I just want to say, first of all, it's the holiday time of the year again. We just are getting close to finishing up our year here at Pediatric Dentistry. It is the middle of December. We are very close to Christmas. My son decided to remind me this morning that it's 5 days or 6 days till Christmas. So I just want to wish all our families a Merry Christmas and a Happy New Year and Happy Holidays across the board. I know there's a lot of them now, so I just want to cover all of them for you guys. Today, we are going to talk about something that's very near and dear to my heart. We're going to talk about sealants. Some parents had some questions about sealants, and sealants are one of those really cool topics that a lot of us hear about, don't understand what the dentist is telling them, so I figured I'd clarify it up. First of all, sealant material is a material that is designed to go on the biting surface of molars, traditionally on the 6-year molars and the 12-year molars, but occasionally we'll put them on some primary teeth as well, some of the baby teeth, to help protect against cavities. Now, that does not necessarily mean that these materials are perfect. Nothing we put into a person's mouth is actually perfect, but the big thing that we're trying to do is prevent food from getting stuck in the biting surface grooves of those back molars. The reason why we're so concerned about that is because kids at that age traditionally are terrible brushers. I was reading a blog posting from another dentist saying that, would you allow your 5-year-old to wash all your good china? And that's sort of the way I look at it in terms of like having the ability to clean your teeth. It's the same process. You're using hands to clean things. So if they're not able to write the check for the payment for the cavity in cursive handwriting, or they're unable to clean your fine china or fancy wine glasses, then it's probably not a good idea to let your children brush their teeth on their own. But as parents, we all turn our kids loose and we basically say, brush your teeth, go brush your teeth. So early on, we try to put these sealant materials on the back molars to help protect those teeth. They don't go on the total tooth. They go on the biting surface only. There's a bunch of other surfaces that do not get covered by these sealants. So I warn parents that if we decide to use sealants, they're only going to do the biting surface. Most of my kids, I worry about them getting in between teeth cavities at a certain point. So they still need to work on flossing. They still need to brush their gums. They still need to brush around the backs of their teeth. But this will help prevent like gummy bears and fruit roll-ups and other really sticky, high carbohydrate foods getting stuck on the biting surfaces. We've all seen our kids open their mouths. They'll have all that stuff like Cheetos, or they'll have goldfish stuck on the biting surface. It looks like yellow or orange inside. So that's what these sealants are designed to help protect. Now, good thing is, sealants do protect that. On kids on relatively moderate to high cavity risk, we strongly believe in placing them. But there's also a newer thought process going out there for kids who don't have as many cavities, or never have cavities, or have really perfect hygiene. And a lot of our patients, we're not throwing sealants on every kid that we see because sealants can break, chip, and crack. They're made of an artificial material. So if they break, chip, and crack, there's a possibility that the sealant materials could catch food around them, creating surfaces where cavities could form. And on a kid who's never had a cavity, if we place sealants on those children, we have to be very mindful of the idea that you may create a surface where a cavity can form. And that's not the goal. The goal is preventative, prevent. The other big thing that we consider too is kids' behavior. Because if kids screaming, yelling, and crying while we're trying to put on a sealant, putting a bad sealant on is not better than no sealant at all. There are some controversial discussions about that, but most of our providers have found that when we try to put sealants on kids who are having a really tough day, it usually doesn't go well, and the sealants won't last even to the parking lot, is our running joke. We guarantee this to the parking lot when a kid is screaming. So, but the big thing is talking about sealants is that because of our office, the way we look at these things is that they're preventative. So we want to make sure that if we decide to do sealants, that one, we understand that kids are going to be tough on their teeth. Two, internally, our office decided when I started way back when is that if we place a sealant, we have to guarantee it. So if we have to go in and replace a sealant because it's broken or chipped or cracked, then we do that for you guys. Even if the insurance isn't going to pay for it, we'll take care of it for you guys. And the sealant materials themselves, the procedure is pretty fast. It's basically almost like putting nail polish on, which I honestly don't know because I don't wear nail polish. But it's a process that's pretty quick. You basically have to open your mouth. They put on a little cleaner on the tooth. It's a cleanser that helps clean the tooth off. It's actually an acid. Shh, don't tell anybody. But it's a really strong acid that goes on the biting surface that's blue. Then we rinse it off, making sure we don't get any in the mouth because it tastes really bad. It's really sour, like citric acid-y tasting, like oranges or lemons. Then we go ahead and put a bonding agent on, and then we put our sealant material down. And each step, we hit it with a really bright light. And it's a really bright, pretty blue light, which is tough because you want to look at it. It's like, oh, the beautiful light. So we always have our parents look away. Our kids are usually watching the movie. The people who are doing the sealants try to look away as well, and just try to make sure that the sealant gets on. The process, like I said, it's a pretty fast process. It'll take about 1.5 minutes to 2 minutes per tooth. Usually we can get them done on a cooperative patient in about 10-15 minutes. And the cool thing is they're covered pretty well by insurance. So a lot of times parents don't have a big copay with these things. That all being said, it's really a discussion we like to have with our parents and decide to see what they want to do in terms of their kids' care. If parents are pro-sealant, we'll put them on. If they're totally against sealant, we will just monitor their surfaces and make sure that we do our best to inform parents about the options that are out there. But the key thing is we want to be part of that discussion, like this YouTube video. A parent asked me about doing this and decided, hey, let's go through it. And it's almost Christmas, so I want to at least have a chance to wish everybody out there a Merry Christmas, Happy New Year, and happy holidays across the board. And if you guys have additional questions, please feel free to hit me up under this YouTube down here, please. And you can follow us here, I think. You can also ask us questions on our Facebook. We don't have to set up separate question pages and all this other stuff that a lot of people try to do. We just basically will respond to your requests. So if you have anything you want to talk about, please feel free. Otherwise, I'll see you in the new year. We can have more discussions and more talks about some of the processes that we do here at Puget Sound Pediatric Dentistry. Merry Christmas and have a happy holidays.